All new at 6 tonight, frontline workers at one of Western New York's biggest hospitals are coming forward. They say a supply shortage is putting their lives at risk. This, as a major healthcare company, is making some changes now after an I-Team report from just 24 hours ago. Here's our chief investigator, Charlie Speck, with the latest developments from today.
I'm on the front line. My coworkers are on the front line. We don't know who's coming through the door. And on top of that, we're a level 1 trauma center.
Trauma is an everyday reality at Erie County Medical Center. But nurses like Lana Denisco say the coronavirus has taken the pressure to a whole new level.
We work in high stress environments every day. We know that lives are on the line every time we go to work, but now our lives are on the line.
Denisco is a nurse in the ER and says a lack of N-95 protective masks is causing nurses to fear for their safety. She wrote on Facebook, "I hug and kiss my kids as if it's the last. I have contacted friends to be surrogates to my children in the event I am infected. This is the best protection we have?"
We need the masks. We need the N-95s. We need the protective garb. I shouldn't have to go to my charge nurse and ask her to unlock supplies so that I can get what I need to be protected.
Her comments come a day after nurses at Catholic Health voiced similar concerns about protective masks that were under lock and key. But at ECMC, officials deny that a problem there even exists.
The nursing supervisors are always there with masks. There's always somebody on the units that are available that can get to the masks. Some of them are locked up in specific rooms, but it's not that they can't get them, they just have to ask for them.
ECMC Vice President Charlene Ludlow says the hospital puts regular surgical masks on all visitors and staff. As for the N95s, she says the hospital is keeping them locked up to prevent theft.
We don't want them to be gone. We want to make sure they're used when they're working there. Other hospitals have had problems where people were coming in and taking, whole boxes.
But Tuesday we heard from a second nurse at ECMC who sent us text messages from a group chat among nurses. One said, "The hospital is threatening termination if any employee on that floor has an N95 mask on, unless they are treating a patient that is intubated."
I don't believe we would terminate anybody for something like that. I mean, I'm not sure where that was said or how that was said. I'm not sure what happened there, but that's not our normal practice.
All of this is taking an emotional toll on medical professionals who are used to dealing with trauma on a regular basis.
We have people that are physically and mentally are having to coach themselves into the emergency room, sitting in their cars in tears before they come to their shift. That's crazy.
One update to our Catholic Health story, the nurse who spoke with the 7 Eyewitness News I-Team about those masks says our story had immediate impact. Because of you and your team, every nurse not only has N95 masks, but they also have full PPE gowns. For the I-Team, Charlie Speck, 7 Eyewitness News.